Okay, so we will see what are the observation. Is it visible? Slides?
Yes, ma'am.
So we will see what are the observation. We will just 1 second. Okay, fine. Is it visible?
Yes, ma'am.
Yes, ma'am.
Okay, so we'll see what are the observation of the patient in the post-operative period. Okay, mainly which comes in the recovery room. Okay, so like I've said, okay, so the patient on the first day, we have to keep a very close observation of the patient. Usually on the first day, especially for those patients who are under general anesthesia, we never allow them to take anything by mouth. Okay, since they are still having the effect of anesthesia, so their muscles, everything is relaxed, right? So all those reflexes and all, they might still not have all those. So we usually keep the patient NPO, which means nil per orally. So we keep them on IV fluids, intravenous fluids and all. Then we have to always check the vital signs every 15 minutes or more frequently, depending on the situation of the patient. Then once the vital signs are becoming stable, then we can start observing or taking the vital signs every 2 hourly. That means every 2 hour we will check the vital signs. And then after that, as the patient becomes more and more, has his condition improve, then we can check it after every 4 hours. Normally in the hospital, for those who are like not having that much problem or any form of complication, we always check it 6 hourly or 8 hourly. Okay. Then we have to complete the current. So suppose the patient, if he's already having any intravenous fluid connected from the operation room, so even if according to the doctor's orders, we can continue it, and we can discontinue it as long soon later on after the patient becomes more and more stable. If he is allowed to take orally, then once the patient can take orally by mouth, then we usually discontinue this intravenous fluids. Okay, and also we administer analgesic medications to relieve pain, and we administer antiemetics if the person's usually because they have this vomiting and nausea and all. Okay, so to relieve that, we will provide them with antiemetic drugs. Then encourage the patient to take a deep breaths. So this it helps in improving their respiratory status, as well as it helps in relieving their anxiety and stress. Okay, so we have to also turn the patient every 1 to 2 hours. This is relate to those patients, especially those who are not able to do it by themselves. Okay, so we can, if it is not this one, if there is no contraindication or if the doctors allow, then we can do it. Okay, and this it really helps in the patient's breathing, or also it helps in improving his ventilation. Then the main points what we have to do. Okay, so once the patient comes in the recovery room and also the main thing is we have to always keep in mind is, first of all, we have to always keep a check on the vital signs like I have said. So we can do it every 15 minutes, and as the patient stable, we can continue it after 2 hours or after 4 hours. Okay, then intake and output. So intake, actually what is it? It is whatever the person is taking. Suppose if the person is not taking anything orally, so intake what it comes, so we have to take the intravenous fluids. So that intravenous fluid, whatever the saline the patient is getting, that it counts as the intake. And output, when we say output, that means it comes all the blood loss, okay, the amount of blood loss or the amount of fluid which is there in the drainage tube, okay, our urine output. Okay, so all this actually comes under the this one. What happened? Okay, so all this comes under the intake and the output. Okay, so like the IV fluid, okay, this come in the intake. Oral fluids, if the patient can take orally, if later on if he is allowed, then that also comes under the intake. Then the nasogastric aspiration, so that is actually whenever we insert any form of nasogastric tube. Like I've said, this nasogastric tube, actually it is inserted from the nose directly to the stomach. Okay, if the patient is not allowed to take anything orally, suppose if the person is undergoing some form of surgery of the stomach or surgery of the parts of the esophagus and all, so in order to relieve the discomfort or even to help the particular area to be healed, so we don't allow the person to take orally, so they usually they can insert this nasogastric tube and all. Okay, Then wound drainage means whatever, if you remember in the previously also I have shown that drainage tube. So that some uh, bottle is there which collected all the drain of the wound. Okay, so with that also we need to measure, we always have to measure the amount. Okay, before discarding it we have to take the amount, see how much is the amount, okay, in ml. Then we have to note it down in the blood loss. So the blood loss, if the patient doesn't have any form of that drainage tube, so how we will know the blood loss? We can see from the dressing, okay, or the wound covering. So for there also you'll be able to see the amount of blood loss. Then abdominal guard is nothing but they will take a measurement of the abdomen, okay, by using of the measuring tape. So this is actually helps in identifying if the patient is having any form of abdominal distension. Abdominal distension means the person's abdomens will increase, okay, the size will increase, and he will also have a very slight discomfort. And this is actually very common if the person is having any liver problem, or if the person is having any form of elimination problem or constipation. Okay, so the person usually have this abdominal distension. So we will also measure the urine output. This is very important. Okay, so we have to make sure that whatever urine output, so if the person is if he is able to do it by himself, okay, so we usually give the urine bedpan. Okay, bedpan is like a this one only where we help with the help of the nurse or even the helper. Okay, they will help the individual, then we will give to the bedpan to the patient so he can avoid or he can urinate there. And also after that, all that whatever persons he urinate, we have to always keep a measurement how much is the output. Also we have to also see if the person, if he is if there's any form of catheter inserted in the patient. Okay, all this thing you'll be learning later. Okay, we have so many procedures also for insertion of urinary catheter and all. So with the help of the urinary bag, okay, that bag which collected the urine, so from there also we can measure the urine output. Bowel movements, that means we have to, if we have to ask, if you have to see, okay, how is the patient's bowel movement, whether he's having bowel movement is normal or not, or whether he's having any form of constipation. Constipation is very common complication seen in a patient post-operatively, especially for those patients who are just become, who cannot move, or who which in which movement is some restricted movement is there, or if he's having any other physical mobility, immobility, and all. So that in those type of patient, constipation is actually very common because their body is not active. So that's why even their bowel movement also becomes very less bowel movement is seen. So because of that, they usually have this constipation. Okay. Then other than that, okay, so we also have to see for the signs of hypovolemia. Okay, from the word itself, hypo means less, volemia means this is the amount of fluid in the blood. Okay, so actually this is very important. So hypovolemia, why we usually see, when we usually see it, when the persons have and this one adequate amount of blood loss. So if the blood loss from the body, maybe because after the surgery, it depends on the surgery also. Suppose if the surgery, during the surgery time, so lots of fluid or amount, lots of blood is being lost from the body. So in that case also the person will have this hypovolemia. Okay, so what are the main signs which we see? Okay, first of all, the pressure, the blood pressure will go down. So once the blood pressure, that's why immediately, that's why that is the main reason why we have to always keep a frequent check on the vitals. Okay, they are very important. That is the only reason also why we call those, all those as vital signs. Vitals means a very important function of our body. Okay, so then if the person have a very decreased urine output, okay, so if the urine output is less, suppose if it is less than 1500, okay, ml per day, then we can understand that the person is having a less urine output. So that also it might be an indication of that the person's body is having less fluid. That means the overall body is having less fluid. Then increase in the pulse rate, that is also signs of hypovolemia. Then decrease central venous pressure. So when we say this central venous pressure or the CVP, actually it is a blood pressure measurement of the right atrium and the vena cava. Okay, if you see, even I have given the diagram of the heart. Okay, so I hope everyone, I think by now, I think your mom have started, I think, this circulatory system. Okay, so the pressure, so whatever we say central venous pressure, it is actually the blood pressure measurement of the vena cava. In vena cava, when we say, it comes the inferior and the superior. So whatever pressure of blood, whatever comes inside the heart. Actually, the blood from the superior and the inferior vena cava, where it goes, directly it will go into the right atrium. So that pressure of the blood, okay, so that is called as the central venous pressure. Okay, so that is also a very important indication that the person is having hypovolemia. So if a person is having decreased fluid in the body, then he will have a decreased central venous pressure. Then if hypervolemia, okay, so hypovolemia, when does it happen? Suppose if you're doing giving any form of IV infusion to the person, but if you're not keeping a check on the patient, so if you're giving overloading of this IV fluid also, it might cause your hypervolemia. Okay, so what are the signs? The like firstly, the person will have increased blood pressure, and also he will have increase in the central venous pressure. Okay, so these two signs, actually they are opposite of the hypovolemia. So these are important signs that we have to observe, okay, for a persons after the surgery, hypo and hypervolemia. Okay, so after that we have to also check for the respiratory status. That means we have to check for the person's breathing, if you have any form of breathing difficulty. Okay, then also pain is very important. Okay, so every patient, like after coming out of the surgery, he will have pain, but also pain also, it depends on the type of surgery. Some person might have very minimum mild pain, some might have moderate pain, some might have severe pain. Okay, if you can see, actually I have given one pain scale. This is a very commonly used, okay, in a hospital. We always use this. So how do we scale the patient? Okay, based on their facial expression. So we will see, and also we will, if the person is conscious, we also ask the patient to describe what is the pain, whether he feel how much is the pain. Okay, so and if the just otherwise, just by seeing the patient's facial expression also, we'll be able to know if the person is having a mild pain. Okay, a mild pain, actually we consider it at 1 2 3. The overall scoring, actually it is from 0 to 10. Okay, so whenever a person have 0, so that means, or if he's having those facial expression, that means it is an indication that the person doesn't have pain. So we will score it as 0. Okay, and if the persons have all those 1 2 3, so if depending on the those whatever facial features or expression is being given, so we'll know that the patient is having mild pain. So mild pain, it is usually 1 2 and 3. So if 1 2 and 3, so this, it is called as a mild pain. Okay, and if the patient is, if you can see, if he's looking very distressed, okay, is very intense, he becomes very agitated and very restless. Okay, so you'll be knowing that the patient, he was having moderate pain. So moderate, it is 4 5 and 6. Okay, and whenever the person's asked, the intensity of the pain increases, the person also will look very intense. He will have more he some where he'll become more irritated. Okay, then he will try to, even sometimes they might even cry. Okay, he will make some sounds, because of his intense pain. So for that, we give the severe pain score. That means it can be in between 7 to 10. Okay, so 10 is the maximum score and 0 is the minimum score. So if it comes from 1 to 3, that is the mild. Then moderate is 4 5 6, and sometimes it depends also. Okay, some pain scale, even till 7, they are considered it as moderate pain. Okay, then after that, all those till 10, from 7 to 10, it is considered as a severe pain. So this pain scale is actually very important. So even in whenever we write any nursing diagnosis for a patient having any acute pain, usually after surgery we always call it as acute pain. Because why we call acute? Because the pain will be present only for a particular days, because that pain is why, because of the operation. Okay, so because of that operation, the patient will have that pain. So we always refer it to as acute pain. And chronic pains means these are those pain which usually last for prolonged period of time, like more than 2 weeks and all, which is seen in case of persons having some form of cancer and all those. So for them, they have chronic pain. So, but a patient who comes out from the OT, they usually have this acute pain. Okay. Then also we have to check, likewise, we also have to check the operation site for any bleeding or for any discharge. Okay. So whether the drainage tube, whether it is fixed or not, whether it came out. So all those we have to keep a check on the patient. Okay, so care of the wound, this is also very important. Okay, so wound caring, actually what, for every patient after the surgery, we usually do this dressing. Okay, so even for dressing and all, we will be, even in the practical, it is there. Okay, so we'll be teaching you all about the how you will do the wound dressing. Okay, and what are even in the next class I will be teaching you all about what is wound. Okay, what are the different types of wounds, then what are the various methods of wound healing. So all those process I will be teaching in the next class. Okay, so but usually this dressing or retching is nothing but we are cleaning the wound. Okay, so we have to always clean it daily. We have to change the bandage whatever we applied, or the gauze piece or the cotton. We have to change it every day, and we have to always maintain the sterility. This is very important. Okay, so whatever articles we are using for cleaning the wound, all should be sterile. Okay, either by boiling it or by autoclaving and all, because otherwise if you don't maintain cleanliness, if you use any unsterile equipments or any other instruments for cleaning the wound, it might cause infection. Okay, so infection is also a very dangerous complication after surgery, so we have to always keep everything clean. Okay, so this is actually this wound dressing, cleaning and all will be in detail you will be learning in the practical. Okay, so we will be taking the practical class how you will clean the wound, but this is actually just simple types of wounds. So how, what are the methods which you can use? Okay, so actually whenever we clean wound, we always use this artery forceps. Okay, and we always use the gauze piece. So for which, so if depending on the type of wound also, we can go either top to down, or it can be from outward to inward. Okay, and or it can be from in the circular motion. So if in the first one it shows, okay, so we have to all will in this first one they are cleaning it from top to bottom. Okay, and whenever we swipe one, suppose we already use one cotton for first one in the from the middle. Okay, so after immediately after you finish that, we have to discard. We should not use the same one twice. Okay, so one swab, one cotton. Okay, like that. Then in the second one, so this is another method which we can clean. So we can clean it from inward to outward. That means from inside to outside. So similarly here also we have to use one swab, one cotton or one gauze piece. Okay, and then the third one is circular. Whenever we follow the circular motion, we have to always follow from inner to outer. Okay, so this thing we will teach you all in more in detail when we will learn in the practical. Okay, so you'll be learning the wound dressing. So the diets of the patient. So related to the diet, all patients, suppose if they are already allowed to eat, okay, so we always, if they don't have any form of, if they don't have any form of abdominal surgery, or if they have any simple surgery, okay, so we can allow them to directly have a normal diet. Okay, and if the person have any abdominal surgery and all, then like intestine, in surgery of the intestine, we can advise them to have clear fluid first. Then after that, we will later on we might allow them to have semi-solid diet. Okay, then time to time, then as the patient recovers, then we might give him to have normal diet. Okay, then provide a diet which is rich in vitamins and minerals, as well as we always provide a very high protein diet. Okay, because protein, as you all know only, okay, even in a balanced diet, so it is a bodybuilding food. Okay, so it really helps in repairing of the wound. So in order for the wound to repair or for wound healing, we always need a protein rich diet. Okay, so we always try to provide a patient with a protein rich diet, as well as a diet which is rich in vitamins and minerals. Then also the last thing is also what we need to do. We always need to give some form of health education, post-operative health education. So this is important. So we can give health teaching on various aspects. So suppose how the person, how they have to maintain the personal hygiene, okay? And if they are still having the, how they have to maintain the diet. Okay, so they always have to eat a very healthy diet. Okay, then they always have to take a diet rich in vitamin, minerals, then diet rich in protein, which helps in the wound healing process. Then ambulation. Okay, so like, and when we say ambulation means we will tell them what are the activities that they can do. Okay, suppose if the persons have done any surgery of the abdomen. Okay, so depending on the surgery also, it depends what type of activities they are permitted. Okay, so all those activities, what are the activities they can do, what are the activities they cannot do, so all those we will involve in the ambulation. Okay, then any adjustments to be made in the occupation of the patients depending on the surgery. So then any drugs. Okay, drugs and medication is important. So after the surgery, okay, when the patient will go back again to their home, okay, so what are the drugs that they need to continue, how to take those drugs, so all those also can be taught. Then also some we can also involve the patient as well as the patient family. Suppose for some procedure, suppose this colostomy, actually it is if you remember in the previous some first class, I think I have shown you related to the when we explain about the types of surgery, where we talk about the colostomy wound. Okay, so this is like we have a colostomy bag. So how that bag, okay, actually that bag need to be changed depending on the patient's condition. Okay, so maybe it can be changed, we need to change it twice in a day, thrice in a day. So for that, the patient, he is not possible for the patient to always come to the hospital. Okay, so for changing that colostomy bag, we can teach the patient how to do it by himself, or even the family members if he is not able to do it. Okay, then we'll also teach the family related to all various types of exercises that they can do. Okay, how much they can do, how much is allowed. Then also we will tell them about what are the various follow up they can do. Follow up means we will advise the patient when he needs to come back to the hospital. Okay, so and in between, if you have any complications, then how we need to report to the hospital. Okay, if you see, these are some of the post-operative complications which is mostly seen. Okay, if you see from the pulmonary circulatory system, so the most common complication is the pulmonary embolism. So pulmonary means it is your lungs. Okay, embolism, that means it is a blood clot. So what happens whenever is the blood clot in the lungs? It might cause the a disruption in the blood flow. Okay, as well as it might cause the patient to have decreased oxygen supply and all. Okay, so and other than that, the person also have this hypovolemic shock. Hypovolemic shock, why it happened? Because whenever the persons have adequate fluid loss. Okay, so in that cases also the person might have this uh, hypovolemic shock. Then the person's some complications are like infection. Okay, infection is also very serious complication, because some if the infection becomes more and more, okay, then it might even lead to so many other problems also. Then what is dehiscence? Actually, dehiscence is what happened whenever this also when I will be teaching related to the types of wounds, I will be explaining more in details about this dehiscence. So this is whenever after the operation, suppose if the wounds edges of the wound it becomes separated. So that is also one form of common complication, or it becomes loose or separated. Okay, then gastric dilation case. Then the person may also have paralytic ileus. Why they have paralytic ileus is mostly, especially for a person's undergoing general anesthesia and all. Okay, so the persons might be have because of the effect of the general anesthesia. So the bowel movement also might be still. The bowel movement also might be still less. So even the not only that, the persons might have constipation. So all those it comes under the paralytic ileus. Okay, then the person will also have this atelectasis. Okay, then pneumonia. Pneumonia is also a very serious complications of this one. Okay, post-operative complication. Then also other than that, the person might also have this urinary retention. So these are actually some of the common post-operative complications. So under that, actually they have given a few what are the signs. Okay, so you all can go through by yourself all those later, but you just have to remember that the main post-operative complications are your pulmonary embolism, hypovolemic shock, okay, infection, dehiscence, then your paralytic ileus, atelectasis, and pneumonia and urinary retention. Okay, so these are some of the few nursing diagnoses. So nursing diagnosis, actually the more you will practice or the more you will learn later, okay, for whenever you go for your clinical visit, so that time you'll be able to know properly how to formulate and all. Okay, so the main nursing diagnosis, actually, when what is there when it comes to post operative, it is the ineffective airway clearance, okay, related to the effects of medication or anesthetic agent. So that's why we always have to maintain a very clear airway. Okay, so those methods only, which I have already said, how we should maintain by keeping the patient in side-lying position, by doing suctioning, then by also providing this one oxygen therapy. So all those, it helps in clearing the airways. Okay, then acute pain, this is also very common. Okay, acute pain because of the surgical incision. So for relieving the pain, what we can do, we can sometimes we have to keep the patient in certain comfortable positions. Then we have to administer some this one hot pack, suppose like this one hot water bottles and all those helps in reducing the pain, or we can provide the patient with painkillers. Okay, all those interventions we can do as a nurse. Okay, impaired physical mobility, okay, related to depressant effects of anesthesia, activity restrictions. So whenever we say impaired physical mobility, that means the patient, he might be not be able to move freely because of the operation. Okay, because of the operations, so certain activities he is not able to do. That is called as impaired physical mobility. Self-care deficits related to the surgery. So that means he will not be able to do all his daily activities, suppose like brushing, combing hair, taking baths. So for all those, he will not be able to do it by himself. Okay, so that is called as a self-care deficit. Okay, risk for fluid volume deficit related to loss of fluid, because after the surgery so much of blood will be lost. So for that, the person might have the risk for decrease in the fluid volume. So these are some of the common nursing diagnoses. Other than this, actually, we have so many nursing diagnoses also related to the post-operative care. Okay. So I hope everyone is clear. Any question? Yes. Okay. So please go through the slides. I'll be sharing. Okay, the slides. You go through, and if you still have any questions, then you ask me. Okay, in the next class. So in the next class, I will be starting with all the wound. Okay, so that is wound healing and all that is very important. Okay, so what are the wounds? What are the various types of wounds? Then what are the various methods, how the wound healing takes place and all, and how to do this related to your surgical dressing and all, that will be done practically. Okay, so when you come back to the college, we will do the practical, how we have to do that wound dressing. Okay. Okay, thank you everyone.
Thank you,
Thank
ma'am.
you, ma'am.
Thank you, ma'am.
Thank you, ma'am.